Hi, this is Dr. Rhonda Fellheim. We're going to take a look at blood flow and several variables that affect blood flow. And the two key variables that we'll be discussing are indeed blood pressure and resistance. So in looking at blood pressure, we know that blood pressure is measured according to the pressure that it's putting on the walls of the arterial system, the vessels in the arterial system. And so there are several numbers that we expect to be within the given ranges if everything is going well. And so one such measurement is pulse pressure. And pulse pressure is measured by systolic minus diastolic. And we would expect that to be about 40 to 45 millimeters mercury, that difference. But if it's not, like if the difference is much greater or much less, then that can be reason for concern, and further evaluation should take place. Another way of looking at blood pressure is through the mean arterial pressure, MAP. And here's the equation for MAP, and this is read diastole plus pulse pressure divided by 3. Or you could say pulse pressure divided by 3 plus diastole. And we would expect this number to be in the range of, around 95 or so, plus or minus a few. What this is going to tell us is what the mean pressure is throughout the arterial system. And so, we use this equation because what we're measuring is the same as if we could, within one cardiac cycle, take a whole series of blood pressure readings at like 0.1 second apart. Okay, and that would give us then a mean arterial pressure. Obviously, we can't do that. So here's this equation, this great equation that we can work with, and that will actually tell, and it gives us one number to work with, the mean arterial pressure, rather than the systole over diastole. So this is a very useful number, again, in telling us the mean pressure in the arterial system. It can also be a good indicator if the key arteries are not particularly healthy. If they're losing their elasticity, becoming rigid, it will affect this number. And so that really does help us to key in on the health of some of the major arteries up nearer to the heart. Okay, and the next variable that we're going to look into then is resistance. And we know that resistance within vessels, falls into the category of friction, and we all pretty much have a good idea of what friction is. But some of the different variables that influence friction or resistance are the diameter of the vessel itself. Obviously, the smaller the diameter or radius of a lumen, the greater amount of resistance that would be offered to blood flow. The length of the vessel. Keep in mind, this blood has to go from my heart all the way to my big toe, and the further it travels, the more friction and resistance it will be exposed to and experience. Last but not least, viscosity or thickness of the blood is also a factor that could create some resistance. The thicker, the less well hydrated an individual is, the more viscous their blood will be. Okay, hence increasing resistance. One of the ways we look at the relationship of these two variables to blood flow is through this equation. It's a very telling equation, and it's I love this equation, by the way. So anyway, blood flow is equal to the change in pressures over the resistance to blood flow. So essentially what this means is that blood flow directly correlates or is directly related to change in pressure. So If pressure goes up, blood flow goes up. In other words, if there's more push behind it, then the more the faster and the greater amount of blood will flow. Okay, more push, more blood. Now, blood flow is indirectly related to resistance to flow. If resistance goes up, for whatever reason, if there's more friction or length of the vessel or decrease in radius, whatever, if resistance goes up, blood flow goes down. And so when resistance goes down, blood flow goes up. All right, so that's what this is. That's what these relationships are for this equation. So let's just take a look at what that means. Don't get overwhelmed by this picture, okay? Here's our equation again. And I love this picture. I love the way we can work with this picture. So let's just first take a look at what we have here. We've on the left, on the y-axis, sorry, on the y-axis, we have our blood pressures, millimeters mercury here. And then on our x-axis, we're looking at vessels closest to the heart, at where the blood comes out, the aorta, okay? And then we're moving away from the heart into smaller and smaller arteries, into our capillaries, and then out on the venous side through our venules, small veins, large veins, and to our vena cava. So we're back to the heart here. So let's look at blood flow when it's just coming out of the left ventricle into the aorta up here. Sorry. Our blood pressure is 120/80, huge push behind the blood coming into the aorta. That blood is going to be moving at about 1200 millimeters per second. That's whoosh, like major fast gush of blood into that aorta. And so this represents, this major blood flow we've got coming in to our aorta. And look, as we move into vessels that are somewhat smaller than the aorta and we move away from the heart, our blood flow is decreasing. Blood flow is decreasing, as is our pressure. Our pressure is decreasing as we move away from the heart. Okay, so we get into smaller vessels, which are indeed creating some resistance because of their size and their distance from the heart. And by the time we get down to arterioles, that blood is only moving at about 15 millimeters per second. Now, look at what happens when we get into the capillaries. Remember, they're only the wall of a capillary is only one cell thick. So, as the blood pressure can't be what it is up here when we're near the heart. It's got to be much less, and indeed it is. We're down to about 20 millimeters of mercury by the time we're at the capillaries. All right, so blood pressure is decreasing, blood flow decreases 0.4 millimeters per second through the capillaries, compared to 1200 millimeters per second in the aorta. So significant difference. Fits beautifully with this equation. Okay, so as we come out the other side of the capillaries into the venules and small veins, we can see that blood flow picks up a bit. We're up to 5 millimeters per second. And if you consider what might be involved with that, I would hope that you would conclude that it's because, okay, we're not in this mesh of capillaries anymore. The venules and small veins are now a direct shot and much straighter, and their lumens are larger than those of the capillaries. So less friction and less resistance in general. And we move into larger veins. It picks up more speed, until we get up to about 80 millimeters per second by the time we are in the vena cava back towards the heart. So let's look at these pressure changes again. I said as we get to the capillaries we're at about 20, so anywhere that we are in the venous system, we're below 20 millimeters of mercury. So any blood coming back towards the heart is going to be below the 20 millimeters mercury pressure. Well, that's kind of interesting if we look at the pressure in that way, and the fact that here's where we would expect the blood to then re-enter the heart. And so if we think about the pressure inside the heart, as the tricuspid valve opens and the right atrium then empties, there's just a brief hesitation there, just a brief bit when blood is flowing into the atrium and the AV valves open and the right ventricle starts filling with blood. There is just a very split time there where there's like zero pressure. There's zero pressure in the heart, in the chamber. So the blood is clearly going to want to flow into that. Remember, a gradient. But if we look at this big picture, this is what I think is just absolutely beautiful. We've got this huge pressure gradient that runs through our entire system all the way from the aorta through the systemic vessels all the way back to the heart. So blood is going to want to flow down its gradient through the pressure gradient from higher to lower as well. I just think that's a little interesting tidbit about all this. But anyway, so please just sit and give this some thought and really think about what this picture is saying and how it relates to this equation. Very interesting stuff. Okay, I'm going to move on here. And we're going to take a look at another variable that influences blood flow, and also blood pressure. But we're talking about systemic here. We're talking about, throughout the vascular system, throughout the arterial vascular system, because we're looking at how the difference in the lumen size affects blood pressure systemically. All right, systemically, and blood flow. But obviously, as we said, if vessels are constricted, vasoconstriction systemically, if there's vasoconstriction, and we increase our cardiac output, but increasingly over time, we challenge ourselves harder and harder and harder, and we keep increasing our cardiac output over time. We would expect our blood pressure to rise significantly. And, but if you stop and think about that, we increase our blood pressure, and you keep doing that, and all these smaller vessels are going to just blow out from the increased blood flow that they can't handle if they remain constricted. And so the significance of systemic vascular resistance is that it helps us to maintain our blood pressure when we're increasing our cardiac output by vasodilating those vessels especially those vessels that are carrying the blood to the muscles, because we know that, when we're active, that's where the significant amount of blood is going to be headed to there and to coronary arteries. So increasing the lumen size of the vessels will decrease our systemic vascular resistance, the resistance offered systemically by the vessels. Okay, but vasoconstriction then would increase that systemic vascular resistance, and if we're increasing our cardiac output, that would lead to an increase in blood pressure. So this is how we maintain our blood pressure systemically within a healthy range. As the cardiac output increases, we decrease our systemic vascular resistance, and we accommodate a greater blood flow to areas in need. Okay, that's the end of this section.